Good afternoon, everyone. Welcome to the conference call. I'm Roxana Gapster, President and CEO here at WellSpan Health. We appreciate you joining us this afternoon for an update on COVID-19 here in South Central Pennsylvania. Joining us today are elected officials, employer partners, skilled nursing facility leaders, other community leaders, local agencies, and other partners from our 6-county area. And those counties include Franklin, Cumberland, Adams, York, Lancaster, and Lebanon. You'll recall this past spring, as the COVID-19 pandemic first hit our communities, that we held conference calls to update all of you on our response and the impact to our communities. As you're aware, the number of positive tests and cases in our communities continues to rise. And we wanted to give you an update on what we're seeing both in our community and in our hospitals. We also wanted to provide you with some timely information to the great questions that you submitted ahead of this webinar. Our strong message back in the spring was that it will take all of us working together to slow the spread of the pandemic. And it couldn't be more critical now in what we're facing over the next 3 to 6 weeks. We're more than 9 months into the pandemic, and no matter what group you represent, there's no denying that this has been a challenging time for all of us. WellSpan's 20,000 leaders, physicians, and team members have brought their best to our mission every single day. It's that same spirit that we see in all of you. We appreciate that and thank you for the work you're doing. COVID-19 has claimed the lives of many across our service area, and we only expect this to increase with sharp severity through January. 1 in 3 patients right now in WellSpan hospitals have COVID-19. It's why we need to do everything that we can to stop the surge in our communities. Today, I'm joined by Dr. Tony Aquilina, our Executive Vice President and Chief Physician Executive, and John Porter, our Chief Operating Officer, to share with you the current impact in our communities and health system, some regional data trends, including health disparities in our counties, and our response, including testing and what we know today about vaccines. We hope you'll take away some important themes from the conversation. First of all, we must all remain vigilant and renew focus on safety measures for ourselves, our friends, and our families. Second, we need to instill a sense of urgency in our communities to keep everyone safe. And third, we ask that you consider the need for safe, healthy behavior as you make decisions for constituents, businesses, and organizations. Nationally, we all know we're seeing record numbers of COVID-19 with cases rising in most states. In some areas of the country, hospitalizations have strained the healthcare systems who are trying to serve those communities, some since the beginning of November. Public health experts and epidemiologists agree there are several contributing factors which center on community spread and our society's fatigue with safety measures. I'd like to say a little bit more about community spread. It really means that the virus is being passed by members of the community, oftentimes unknowingly, sometimes by those who are asymptomatic but still have the virus. When we're less vigilant about recommended safety measures, the virus can spread more easily. It's why following masking guidelines is important, because we know the virus is spread through droplets, and so wearing a mask is helpful in preventing that kind of spread. We need to remain vigilant with our safety precautions and behaviors as individuals and in our communities, and it's the only thing we really can do right now to slow the spread of the virus. It's also why we're doing everything we can to remove barriers to timely care. We were very proud to come out in March this year with a policy here at WellSpan that we would not charge patients any out-of-pocket or co-insurance for either testing or treatment for COVID-19, even those who require hospitalization in our intensive care units. We indicated that those services would be submitted to private and public insurers, but that we would not bill patients additional costs for those services. We don't want anyone in South Central Pennsylvania to forgo treatment or to feel that they don't have options for treatment because we really want to prevent the spread of the virus. So this is just one of the many ways that we're staying true to our mission here at WellSpan to be a trusted partner for our communities. Many of you have asked about the status of our WellSpan team members and how we're handling the positivity there. This is something that many of you are managing as well within your own organizations and with your own employees. In April, we asked all of our employees who could feasibly perform their duties remotely to work from home. So we have more than 4,000 team members now who've been working remotely over the past 9 months, and we believe that this has helped mitigate the spread within our own teams. That said, it's been the most significant challenge that we've faced is staffing. Especially in recent weeks, we have seen increasing numbers of our own staff become positive through community spread and lack of proper safety measures. And this is compounded by the growing number of employees who are furloughed because of this. And that number has increased about 70% in the last few weeks. So we have a little over 430 employees right now on furlough for COVID positivity. We've needed to test nearly half of our workforce in the last several months. So we've done more than 10,000 COVID-19 tests on our own employees. We have had about 1,370 positive employees, about 52 that have been hospitalized, and we've had 2 employee deaths. The health and well-being of our workforce has been one of our greatest concerns over the last 9 months because we need healthy team members in order to care for our community. It's one of the reasons why we're asking our community to also exhibit strong, healthy behaviors to keep our caregivers safe. With that, we're going to get started on our agenda today, and we know that we'll be posting today's webinar on our website as well for those who aren't able to participate right now. So thank you again for joining us, and I'd like to hand it over to Tony Aquilina. Thank you.
Thank you, Roxana. And hello, everyone. I'm Dr. Tony Aquilina, Executive Vice President and Chief Physician Executive of WellSpan Health. I started with WellSpan this summer and haven't had an opportunity to meet many of you yet. I do join Roxana in thanking you for your service to our communities and look forward to working with you in the months and years ahead. I'll start talking about impact nationally and then move to what it looks like for us here in WellSpan's geography. Then I'll share with you the latest on testing and vaccines. As Roxana said, case surges are occurring across all 10 regions of the Health and Human Services map in the United States. There have been record case counts multiple times over the last week. Over 2,100 people are dying each day. At the state level, we're seeing a similar increase with infection rates up 440% since August. That's over 4 times as many cases in recent days compared to the late summer. The trend across Pennsylvania follows the national trend with record case counts in recent days. Just to compare, in April, Pennsylvania was seeing case counts around 1,800 cases per day. In the summer, it was as low as 500 cases per day. Today, our average case count has climbed to more than 8,500 cases per day. Since the beginning of the pandemic, WellSpan has administered over 206,000 tests in our 6 counties. As you can see, we've seen exponential growth in demand for testing. In correlation, we're seeing the highest number of patients since the start of the pandemic. Generally speaking, over the summer months, WellSpan hospitals had an average daily census of 50 to 60 COVID-19 patients in all our hospitals. Now remember that hospitalization rate often lags case counts by a couple weeks. In the past few weeks, we have seen a census increase in WellSpan hospitals from 60 to 386 as of this morning. The concern right now within our health system is that our predictive modeling shows our counties may not yet even have peaked from this most recent wave. Our predictive models throughout the pandemic have been rather accurate to date. And based on those models, in the next 2 weeks, we expect hospitalizations to double. We've often thought to ourselves, can this get any worse? The answer, unfortunately, according to these models, is yes. The only thing we can do right now is be extremely vigilant with safe behavior. In addition to the overall increase in cases, our leaders have been intentional about reviewing data trends regionally to determine how we best support the needs of our communities. As happened at the beginning of the pandemic, we continue to see higher COVID-19 positivity rates for Hispanic and Latino community members at 24% across our system. For Black community members, it's at 16%. And for comparison, for white community members across our service area, it is 13%. This translates to more visits to the emergency department and urgent care. We recognized this disproportionate trend and made a number of impactful changes early in the pandemic. First, like translating our COVID-19 web pages, My WellSpan patient portal, and resource guides to Spanish. Placing COVID-19 prevention digital signage in bodegas, churches, and businesses. And partnering with our local federally qualified health centers and community health coalitions to provide outreach, testing, education, and medical services. There's more work to be done, but we have been successful in closing some of the gap between our Black and brown patients and white patients. Looking at age, positive cases are more common among teens and young adults now. While fewer children have been sick with COVID-19 compared to adults, they certainly can get infected and can get sick and can spread the virus. When we look at hospitalizations by age, we're seeing an average age of 66 years old in our hospitals, but we're treating patients of all ages who have had serious cases. It's a misperception that COVID only affects the elderly, or it's only happening to those in nursing homes who are dying. Our care teams watch young people, middle-aged people, and older people succumb to this disease each and every day. Until we have a widespread vaccine, our only defense is safe, healthy behavior. In addition to the rise in COVID cases, it's also starting to be flu season. This combination creates renewed concern nationally about overwhelming hospitals. We often are asked about the difference between COVID and the flu. While mild cases of COVID may feel similar to the flu, COVID is a more severe infectious disease. Once a patient with a serious case of the coronavirus is hospitalized, the average stay is 11 days, about twice as long as the 5 to 6 day average stay for the flu. These people are sicker, and the additional days mean additional stress on the healthcare system. The worst flu season in the last 5 years was 2017 to 2018, which killed 256 people in Pennsylvania. The coronavirus has killed 11,331 people so far in Pennsylvania. We've seen over 355 deaths in WellSpan hospitals alone, with about 2,555 cases. This is why we need to do everything we can to encourage safe and healthy behavior. To protect yourself, your family, and our communities, remember simple, effective steps to stay safe, particularly with the holidays just around the corner. Limit gathering sizes. Even small gatherings carry big risk. Follow masking and social distancing guidelines, and wash your hands and use hand sanitizer. You can visit wellspan.org/COVID-19 for practical tips you can share in your workplace or with your organization to keep safe behaviors top of mind. Let's move now to talk a little bit about testing. We recommend testing to anyone who has been exposed to COVID and develops a fever, cough, shortness of breath, or new loss of taste or smell. To receive a test through WellSpan, there are 3 options. If you have a WellSpan primary care provider, this is the first place to call. If you do not, you can be seen by WellSpan Online Urgent Care. We're offering free visits using the code COVID-19. You can also call WellSpan's Coronavirus Information Hotline toll-free at 855-851-3641. The information hotline is open daily from 8 a.m. to 5 p.m. We do not recommend showing up at your doctor's office, the emergency department, or a WellSpan urgent care site. You need a doctor's order for a test. We also do not recommend asymptomatic testing unless you have been exposed to someone who has recently tested positive and you were in close contact with that person for 15 minutes or more. At this time, WellSpan is not able to provide testing to asymptomatic patients simply based on the fact that they have traveled or are planning to travel. The testing supply we receive regularly varies, and we're working as hard as we can with our lab partners to get additional supply. We're also doing everything we can to ensure turnaround time for the tests is as quick as possible. But the speed depends on our lab partners' ability to process these many, many tests. We know you've asked and we hear you. We're doing everything we can to ensure timely access to testing. Finally, I'll share with you the latest we know about the COVID-19 vaccines. As you can imagine, this is a rapidly changing situation, and we're working around the clock to ensure we're ready when vaccines are in hand. Currently, as of today, no vaccine is authorized. However, 5 vaccines are in phase 3 clinical trials. I'd like to share a bit about how COVID-19 vaccines actually work. The CDC says vaccines of any kind help our bodies develop immunity to the virus that causes COVID-19 without us having to get the illness. Different types of vaccines work in different ways to offer protection, but with all types of vaccines, the body is left with a supply of memory that will remember how to fight that virus in the future. It typically takes a few weeks after vaccination for this to take effect. It's possible that a person could be infected with the virus that causes COVID-19 just before or after the vaccination, and then get sick because the vaccine did not have enough time to provide protection. All but one of the COVID-19 vaccines currently in phase 3 clinical trials in the United States use 2 shots. The first shot starts building protection. A second shot, a few weeks later, is needed to get the most protection the vaccine has to offer. Only one vaccine in phase 3 clinical trials currently requires only 1 shot. We're confident the approved vaccines will have been tested through rigorous scientific and federal regulatory processes to ensure its safety and effectiveness. Regarding WellSpan's vaccination program, we are preparing with guidance from the CDC and aligned with the Pennsylvania Department of Health's interim vaccination plan, which lays out 3 phases. The first phase will focus on critical populations due to the limited supply. This will include healthcare personnel, EMS first responders, critical workers maintaining core functions, essential workers, people 65 and older, and residents in congregate care settings like nursing homes. In the second phase, we anticipate a larger number of vaccines will be available, and this will allow us to ensure that those in phase 1 who are not vaccinated can do so. And then we'll expand our efforts to targeted populations, including vulnerable populations and those people with health conditions that may put them at risk. The third phase of the vaccination process begins when we have sufficient supply of the vaccine or vaccines. In this phase, we will begin to ensure that the entire population has access to safe and effective COVID-19 vaccinations. Operationally, we are ensuring we will be ready to distribute the vaccine during all 3 phases. A question from many of our own employees right now is, will the vaccine be mandatory? Well, neither the state nor WellSpan is requiring people to get the COVID-19 vaccine. However, we are strongly encouraging our team members to get vaccinated, to protect themselves, protect their families, and protect our patients. We encourage our community members to do the same. Aligned with the state plan, our WellSpan vaccination program is focused on 3 major components: closed points of distribution, or pods, for frontline WellSpan team members, likely to start this month, December. Closed pods, or points of distribution, for WellSpan patients, likely to start early 2021, and then open pods for community members that will start sometime in 2021 also. As the vaccine becomes available, timely delivery will hinge on the availability of staff to administer the vaccines in all the pods. Pfizer and Moderna have asked the Food and Drug Administration for emergency use authorization and could be ready for dispensing vaccines in December. Again, this first phase would be designated for healthcare personnel, EMS first responders, critical workers maintaining core functions, essential workers, people 65 and older, and residents in congregate care settings. We're committed to keeping you updated with when and how we'll be operating our vaccination program. Trust me when I say we are working at full speed to prepare. Please continue to look for information from us as we move into the new year. Before I turn it over to John Porter, I want to comment on standard of care that continues to take place every day. Since the outset of the pandemic, we've been committed to ensuring care is not interrupted for those with ongoing health concerns. For both serious conditions and traditional well visits, we continue to see patients both digitally and in person. We're using technology to see patients in every WellSpan practice. In fact, we scaled our digital health capabilities 6 times the national average in April and May. I want you to know that I'm so proud of our physicians and advanced practice providers for their continued commitment to safe, high-quality care. I also want to leave you with strong encouragement to seek care in case of an emergency. We are providing care safely, and in the spring, we saw a dip in individuals avoiding care. This led to more serious issues if they are not addressed in a timely manner. So please share my confidence that we are here for you no matter what. Thank you. And with that, I'll hand it over to John Porter.
Thank you, Tony. Hello, everyone. I'm John Porter, Chief Operating Officer for WellSpan Health, and I'd like to thank you for joining us this afternoon. I'm going to share our ongoing response for the COVID-19 cases in our community and our hospitals. I'll also elaborate on what this means for programs and services. It's important to note that we continue to take a united approach managing this pandemic across all of our care sites and our 8 WellSpan hospitals. Our hospitals are supporting one another, and we've structured our response in a way that uses the strength of the entire system. This support includes moving equipment and team members to where they're needed most. The work also includes our WellSpan Patient Placement Center that we launched earlier this year. It's an operations center that logistically looks at each of our facilities from a capacity standpoint and determines the best locations for our patients to receive care. This includes non-COVID patients and making sure that when they are medically stable, they can be transferred back to their home hospital. Due to high community spread, we are limiting visitors across our care sites. While we know this is difficult for families and loved ones, this is a crucial step to reduce community spread within our facilities. We're doing all we can to support communication through virtual visits using Zoom and FaceTime. I'd also like to comment on capacity. Within our hospitals, capacity is something we can adjust. Up until Thanksgiving, our adjustments were sufficient to care for the number of patients needing to be hospitalized in all of our communities. This is no longer the case. Our challenge is having enough healthy staff to manage hospital operations. We've adjusted some surgery and procedural schedule and reduced some outpatient services such as pain, sleep, laboratory to free up staff to assist in the hospital. While helpful, those steps aren't sufficient given the surge we're experiencing. That's why last week we concluded it was time to postpone some non-life-saving elective surgeries and procedures in targeted locations across our region and redeploy the staff from the surgery centers to our acute care hospitals. We've also transitioned the WellSpan Surgery and Rehabilitation Hospital in York to an acute care hospital to create additional space for COVID patients in our traditional acute care hospitals. Patients are personally notified regarding any changes to upcoming procedures. As you can imagine, this list of procedure and service changes is frequently updated, but you can see the latest at any time on wellspan.org. We are also opening up alternative care sites for COVID patients who require care beyond their hospital stay. The first of those locations actually opened last Monday in Lancaster County. WellSpan Hospital at Home is a service that allows WellSpan to care for patients with low complexity conditions in their own homes. And that's through a combination of visiting nurses, nurse practitioners, and physicians connected with remote patient monitoring devices like blood pressure cuffs and video visits, which will be expanded across all of our regions. Our Arches to WellSpan recuperative care program will be expanded across all regions as well, providing patients a short-term place to heal with room and meals provided. Several area organizations have given us beds, space, and staff to care for patients who don't any longer need acute hospitalization. They include Hospice and Community Care on Good Drive in Lancaster, the Hunter Group, and Bailey's Coach and Health Transport. Our thanks to our many partners for their collaboration on this work. Now, regarding our medical supplies, we have implemented a multi-pronged approach in an effort to ensure our hospital care teams have the equipment and supplies they need. Our supply chain has done an incredible job securing personal protective equipment and other resources needed. Our physicians, nurses, and care teams are the heart of WellSpan, and we are committed to supporting them and keeping them as safe as possible in our communities during this COVID-19 pandemic. In fact, we've had great support from local businesses who came to us early in the pandemic asking how they could help. They told us they would do anything in their power to pitch in to make necessary materials and supplies. This collaborative innovation has been a terrific example of how our communities unite during changing times. That said, each of our facilities across the health system are adequately equipped today to respond to the needs of our patients at this time, including sharing resources when necessary. With regard to specific actions you can take as employers, you've asked us a great number of questions about best practices and suggestions to manage your own workforce during the pandemic. Like other businesses, WellSpan understands the complexity of balancing safety and work. We suggest following the guidance of the CDC and the Department of Health. And while following general science is helpful, we know every employer is different, and we're happy to guide where we can. Our Well at Work team has taken your questions and crafted an FAQ that will be shared with you later this week as a follow-up to today's webinar. It will also be posted to our wellspan.org in our employer resources section. And with that, I'll hand it back to Roxana.
Thank you very much, John. I think you've heard each of us in our own way ask that you work with us to provide information on safe measures for our communities and to do everything we can to keep our employees, friends, and families safe as well. So with that, we're going to get into some of the questions that you asked ahead of time, and John and Tony and I will answer those questions. And then we will also, as John mentioned, have an FAQ document for you afterwards. I know there's been a few questions that have popped up during the webinar as well, and most of those seem to be related to vaccines and testing. So maybe when Tony gets to his question answers, he will answer those as well. So one of the first questions people asked is, what help can the community provide? And I think we've spent most of this call sharing that with you. We really need help with social distancing, masking, hand washing, people not gathering in either small or large groups, understanding that this virus can be asymptomatic in some people, and that if we don't take proper measures, we're continuing to spread that virus. And it may be a non-issue in some patients, and in some patients who get the virus, of course, they require hospitalization and sometimes intensive care. The second question was, how are WellSpan team members doing? I'd just like to say that we've spent the majority of our time prioritizing our teams, and it's been a really tough road the last few weeks for the teams. People are tired. They feel exhausted from the many shifts that they've been working. And as John mentioned, we've been redeploying team members from some parts of our organization to help in other parts. And we're going to need to continue to do that, just as all health systems across the US are doing those same and similar strategies to make sure that we have enough people to care for the people who need to be hospitalized. With that, though, I can't say enough about our teams and their resiliency and the work that they're doing together. We have many supports within our organization for our team members through our Phil Haven Behavioral Health Organization, peer-to-peer phone lines, individual counseling, crisis debriefs, all kinds of things that we're offering for our team members, as well as just regular old employee assistance program support as well. The third question was, the dark days of winter are nearing and many are feeling even more isolated. Are we seeing an increase in mental health care needs, and what are best practices for staying mentally healthy? We are seeing an increase in mental health care needs, both in our own employees and in the community. And I think any of our physicians would share that with you. We have a lot of resources out on our website for patients at wellspan.org/COVID-19. And there's an app called My Strength that we've used both with our patients and communities and with our own employees that can be very, very helpful, and has a number of different resources for emotional well-being. So we would recommend that to you and to your employees. It's a really helpful program that can help people keep their spirits up and help them understand what resources they might need to access. What changes have you made due to the pandemic that we will retain as best practices? Well, I think Tony mentioned a couple of these. One is certainly the digital and virtual visits that we've leveraged over the last 9 months. Our physicians and advanced practice providers have done an amazing job of doing video visits, e-visits, email visits. But it's not just our physicians and APPs who've done that. It's also our physical therapists. It's also our home care nurses. Almost anyone providing a service within WellSpan now is learning how to provide it digitally and through technology. And this has been really tremendous for our communities and our patients as we monitor and care for patients through the computer, something that we've gotten very good at. In fact, over the last 9 months, we've done more than 400,000 video visits. So it's been a really incredible change for us. I'd now like to hand it over to Tony, and he's going to answer a few of your questions.
Thank you again, Roxana. And I have a few questions here that were submitted. So there were many questions asking how effective are masks and which kinds are best. So science tells us that masks do work to slow the spread of COVID-19. A mask stops exhaled droplets carrying COVID-19 from circulating, helping to reduce the spread of those particles. The CDC has also more recently proven masks protect the wearer too. So there was initial thoughts that maybe it was just to protect other people. No, and in fact, it protects the wearer. Again, it's by stopping droplets from getting through your mask and into your nose or mouth. If you've done that, you've decreased the risk of becoming infected. That said, masks can only be effective if worn properly. Also, the CDC recommends choosing a mask with 2 layers of washable, breathable fabric that cover your nose and mouth completely. If you don't have access to a surgical mask or an N95 and you're using commercially developed masks, make sure it has 2 layers. The mask should fit snugly to your nose and chin and the sides of your face without having any gaps. Another question, is it safe to hold in-person events even if adhering to social distancing? Well, we're all faced with many tough decisions right now, especially with the holidays. And I can tell you that even within our own organization, we are not holding gatherings that aren't essential to our work. And when we do, they are as limited as possible. We've canceled our holiday gatherings that our hardworking frontline workers sure deserve and look forward to. Even small gatherings carry risk. Risk increases with higher rates of community spread. And we have a high rate right now. Because of the current rate of infection within our communities, it's so important to consider what in-person gatherings are absolutely necessary. Another question, can you be infected more than once? Well, there are case reports of this. There aren't very many of them, but there's really not definitive data on this. Until it's known for sure, it's best to assume that you can become reinfected, even if you've already fought off the virus successfully, and you should continue to practice all the safety measures to avoid transmission. Next question, is there a possibility of a new strain of coronavirus emerging? Well, that's a harder question than it sounds, because at this time, it's really unknown right now if a completely new strain of coronavirus will emerge. I'm sure you've heard of different variants, and that is happening. There are mutations that happen. The good news is so far that those new changes the virus made in itself haven't increased the risk of contagion. That said, it's still a very contagious virus. Next question, does blood type determine severity of the illness when infected by COVID-19? I'm sure you've heard this. There's been reports on the news that O negative blood type potentially, people with O negative blood type potentially had a less severe disease. but this really hasn't been proven. That just may be coincidence in the people they looked at. So I think at this point, the CDC really hasn't found enough evidence to support that claim. And so basically, it really doesn't matter. You need to, whatever your blood type is, you need to try to not get this virus. Next question. What have you seen regarding spread among children, and how susceptible are children to serious illnesses? Well, cases in children have increased nationwide and locally. That said, cases and deaths are lower in children compared to adults, and hospitalizations are lower in children compared to adults. Children who are under the age of 1 or have other medical conditions are at risk of having more severe illness with COVID-19. Now let's discuss questions about testing, because I know there was quite a few of those, even in the questions posed today. Many questions related to timeline, particularly access to rapid testing, so staff, teachers, et cetera, aren't out for weeks at a time waiting for results. So let me elaborate a little bit on the way testing works and some of the barriers we're facing. So the demand for testing is growing exponentially. Our goal is to provide safe, quality testing to every patient that needs a test. The gap between our goal and the current state is driven by several factors right now. As the demand grows for testing, it takes more time to process the increase in tests. All major labs, including our partner lab, Quest, are experiencing increased demand that's stressing the system like it did in late spring and early summer, when testing turnaround times increased. There are several bottlenecks along the process, including allocation of testing supplies, such as reagents and swabs to perform and run the tests. There are also many new testing platforms that have varied success or do not have FDA approval yet, or don't have proven results really in application. This creates the need for us to continually assess and investigate additional testing platforms that will provide safe and meaningful solutions for our patients. These platforms often do not have the same reliability or a highly reliable supply chain to support the testing volumes being promised. In order to ensure we are able to provide patients who need testing the most, we must continue to monitor the system in order to provide the best solutions that keep our communities, employees, and patients safe while dealing with the environment we are in today. With that background, please know that we hear you, and we're doing everything we can to provide as much testing as quickly as possible. Now, let me kind of address the questions about vaccines, and there's, again, a lot of them and even more today. Number one, are they safe and are they effective? Well, the vaccines have been tested, again, through rigorous scientific and federal regulatory processes to ensure safety and effectiveness. The two that are first to market, Pfizer and Moderna, have COVID-19 vaccines that have proved to be more than 90%, even 95% effective in clinical trials. That's pretty good. That's really good. Are the vaccines from the live virus? No. None of the current COVID-19 vaccines currently in development in the United States or elsewhere use the live virus that causes COVID-19. There are several different types of vaccines in development. However, the goal for each of them is to teach our immune system to recognize and fight the virus that causes COVID-19. I'm sure there are questions about side effects from the vaccine. Most people do not have side effects or serious side effects after being vaccinated. Most commonly, and again, this isn't most people, but your arm may feel sore, red, or warm after the shot. That can happen with most vaccine shots. These symptoms usually go away on their own within a week. Some people reported getting a headache or a little slight fever after getting the vaccine in the trials. These side effects are a sign that your immune system is doing exactly what it is supposed to do. It's working and it's building up protection to disease. Does not mean because you have a fever that you have COVID after you receive the vaccine. These vaccines are being tested in large clinical trials to assess their safety. However, it does take time, and more people getting vaccinated before we learn about very rare or long-term side effects. That is why safety monitoring will continue. The CDC has an independent group of experts that review all the safety data as it becomes available and provide regular safety updates. If a safety issue is detected, immediate action will be taken to determine if the issue is related to the COVID-19 vaccine or to determine the best course of action. There was a question about how many doses of the vaccine will be required. As we said, all but one of the COVID-19 vaccines that are currently in the final phases of clinical trial require two doses. The one that doesn't, Johnson & Johnson, will require one dose. That one has not yet gotten to the point of the Pfizer or Moderna or even AstraZeneca vaccines. It is not as close as those vaccines to being ready for use. The first shot, again, starts building protection, and then the second shot is to get the most protection the vaccine has to offer, like a booster. Next question, how long will the COVID-19 vaccine last? Is a booster or recurring vaccination needed? Well, we won't know how long immunity produced by vaccination lasts until we have an approved vaccine and continue to test it and monitor it. Is it possible you'll need a COVID vaccine every year like a flu shot? That's certainly possible. We just don't know that yet. Next question, if someone tested positive for COVID-19, do they still need to be vaccinated? So the answer to that is yes. I mean, people who have gotten sick with COVID-19 probably still benefit from getting vaccinated as a way to prolong your immunity. Due to the severe health risks associated with COVID and the fact that reinfection is possible, people may be advised to get a vaccine even if they have even if they've previously been infected. Right now, experts just don't know how long someone is protected from when they get sick. The immunity someone gains from having an infection called natural immunity varies from person to person. Some evidence suggests natural immunity may not last very long in some people. We won't know how long immunity produced by vaccination lasts until we have a vaccine and more data on how well it works. So both natural immunity and vaccine-induced immunity are important aspects of COVID-19 that experts are trying to learn more about, and we'll rely on the CDC to keep the public informed as new evidence becomes available. I think that wraps it up for me, and with that, I'll leave the last few questions to John Porter.
Thank you, Tony. The first couple of questions I'm going to address are around capacity, and they are is WellSpan able to handle the current caseload, and what should we do when the hospitals are at capacity? As we covered earlier, we're monitoring important metrics on a daily basis. We have made countless changes to expand our capacity, and we only have so many more options available to us. We have contingency measures that's being planned around the clock to prepare, and that is with FEMA, PEMA, and other health systems to take a regional approach for increasing the need for care. The real question is, what can we all do today? Hospitalizations lag positivity by about 2 to 3 weeks. So we need to take action now to make an impact on our trajectory to keep our health systems from being overwhelmed. Next question is, what do trends look like right now? How long should we expect for this surge? As Tony noted, the predictive models we're anticipating have a peak in the wave in early to mid-January, and hopefully a downward trend as we move into February. The only thing to affect this trend is our own behavior and the decisions we make that impact safe, healthy behavior to slow the spread. I'm certain Roxanna and Tony will join me in hoping the vaccine will move us toward a healthier future. Until then, we need to do everything we can to stay safe. Roxanna, with that, I'll turn it back over to you.
Great, thank you, John. I think there were a couple of simple questions on the Q&A, and I'll just answer one or two of them. One was, does WellSpan have the storage for the vaccines, the really cold storage? Yes, we do. We have storage in each of our regions, and the vaccine will be distributed through the state of Pennsylvania. So at this moment, we don't necessarily know exactly which vaccine we'll be getting or how much, but we should know that sometime in the next week or two. And we will be part of the response to helping vaccinate both our own employees and the community as well. So with that, I want to thank all of you for being part of the call. We really appreciate your leadership in the community to help slow the spread of the virus. Thank you so much for participating today, and we will have this webinar available on our website as well as a frequently asked questions document that you can access after the call. Thank you so much.